Chekai. I need to stop this now. Okay, a doctor and a lawyer loved the same girl. Doctor used to give her a rose daily, and an advocate used to give the girl an apple. Girl got confused and asked, "There's a meaning of giving rose. Why are you giving apple?" Because an apple had... Should have said that. I should have seen that coming. Hey, am I daft? Hey. So what should the doctor have given the girl so that the lawyer stays away? Honesty? Doctor's effort, doctor's salary, sad truth. Anyway, this is not a pity party. Let's proceed. Importance of AP and lateral views in X-ray. So, whenever we send you to do an X-ray, we ask for an AP, which is an anterior posterior view, and a lateral view. You ask for different views so that you can get the whole perspective of the injury. So as you can see here, this is a royalty in England, forgotten his name. When you look from the side, which would be the lateral view, it looks like it's quite obscene whatever he's showing, but from the front, not too bad. So, do you have any disease? No. Do you take any medications? For what? Why do you take the insulin, captopril, statins, and fluoxetine if you have no disease? I mean, fluoxetine could explain her not having a disease. So, insulin is for diabetes. Everyone knows that. Captopril is an ACE inhibitor. This is for hypertension. Statins are used to lower blood lipid levels. They can be used therapeutically or post CVAs, cardiovascular accidents. So, fluoxetine is an antidepressant, I think. Anyway, this happens a lot to us. Patient comes, especially if you're with your professors, they told you they have no disease or anything, but once the professor is like, "Oh, by the way, I hope you've remembered to add my blood pressure medication," and yet you presented the patient as having no other comorbidities. It's quite shocking. I mean, but it is what it is. I think the professors normally understand. What would be unforgivable is if a patient probably doesn't have a head and you say the patient has a head. I don't know, something egregious like that. Relax, Anna. It's just a small surgery. Don't panic. My name is... I saw this haha isn't as good as it would have been, but yeah, this happens, especially to me now that I'm going to my clinical years. I mean, my clinical acumen, my surgical skills are not top notch, and I'm on a learning curve, which I will, of course, get over. But yeah, I mean, you have to really keep yourself calm before you go in, before you do a procedure. That's the first time for you to do, first time for you to be supervised. You fumble a bit, you give yourself motisha, but at the end of the day, top-notch surgeon coming out of the process. What I think I'll look like after medical school, what I'll actually look like. I think both of them look fine. Prefer the one with a beard. I diagnosed a man with wrinkled clothing today. Iron deficiency. There's an anemia known as iron deficiency anemia. That's when your diet consists of not enough vegetables, not enough organ, what's it called? Organ meat. so liver, so that you are down on your iron. And what it presents like is your HB is low and your red blood cells are smaller than usual in size and in number. So that's iron deficiency anemia. But since this guy didn't have an iron, which is that PASI that we know, so anyway, so funny. I don't care if you don't find it funny. I love it. Me and my father before exams. Quick story. I mean, I went to medical school in the regular program. That means I had good grades for medical school. But once you get to medical school, it's like it's not you anymore. The results you get for those exams, and the pass mark is only 50. They're quite benevolent. 50%, and you sail through. But still, I'm just happy my father didn't see my transcripts. I think I once saw my mother looking at my transcripts and she knew not to ask. You're so kind, mom. So kind. Biology came. You know why I have this expression? I mean, it's funny because it looks like it's a portmanteau. What's a portmanteau? Portmanteau. Could be a portmanteau of bio and chemistry, so biochemistry. It is. It is funny. Anyway, biochemistry was the bane of my existence, the bane of any medical student's existence. So regardless of how funny it is, regardless, I will not laugh at biochemistry because it has a way of rearing its head again. And I'm still yet to understand Krebs cycle. So please forgive me if I want to find peace in my life. Okay, people talk about 3G, 4G, and 5G, while nurses play with 20 gauge. We are miles ahead. I don't understand this gauges thing, by the way. I mean, also 18 gauge would be the green one, and 16 gauge would be the gray one. 20 is the orange, and 22 is the blue. The higher the gauge, the smaller. Quite like the 2G, 4G, 3G things, because 5G is a higher frequency, lower wavelength, smaller wavelength, more powerful. I know my stuff, tech stuff. Oh, tech people, coming your way. Problems in your personal life, choose medical career. No person. People drag this out too much. I think you can get to have a proper personal life as even when you are a medic. But still, I think we've normalized not having enough personal life, so much so that we feel like we have good enough personal life while our relationships are hurting, and most of us are married to doctors, so it really doesn't cause strife in the house, but it is an issue. It is what it is. When you're just born, but people have already started judging you on the basis of your score. Yep. When you're born, you get a score of how well you've done. I think crying, is it tone, breathe, I don't know, APGAR score, appearance, respiration, five items, so that each scored 2 points, total of 10 points. 10 over 10 is good, less than 10 over 10 isn't good. Especially if it's really low, then it means that you might be having, it's called birth asphyxia, something. I'm not a peds, I'll confirm. Healthy Farm, paracetamol. Is this ice cream? Or is it paracetamol? Comment in the comment section. Tell me why this is funny. When surgery came from the topic that you left option. You'll be there wondering that stomach is so small. Kumbe it's the gallbladder. Proceed. Your case is quite complicated. Why, doctor? What happened? Yeah. Hi doctors, what's the treatment of dandruff? Radical surgery, do away with it. Better be able to think on your toes. I need to stop this now. Hi guys, I was in a coma since January. Why is everyone wearing masks? The streets. The streets are our theater and we are qualified doctors. Just tell this guy what's happening. He also needs to social distance, he doesn't know. I. Friendships can end, girlfriends, boyfriends can end, only love partner has no end. Oh, I remember my love partners in undergrad. That was a dream team. Hey, we must say it. Okay. Googleopathy is the most modern branch of medicine where patient prescribes medicine to his doctor. Happens quite a bit. Quite a bit. Have I said quite a bit before? Stupid Jack patient friend. Oh. What was this? 18 gauge? 16 gauge is the grey one. 14 gauge is the biggest. So this patient really has been difficult to put the biggest cannula. But no, that's not how we decide the gauge of cannulas to use. It depends on your clinical situation. If you need IV fluids fast, then you'll definitely get the wider bone needle. If you need, there's some medication that can't traverse the smaller cannulas, so you give the bigger cannula. And of course in children you're limited to the blue one and the yellow one. So I mean, we make sound decisions, so you can try not to be a jack to us, but we will not punish you because of how you behave, or will we? It won't go through. This is like the camel going through the needle. It will not go through. You just have to break it down into small manageable parts and your study will sail through well. So free tip, the next one will be costly, you'll have to pay. Dentist pulls out all of her ex-boyfriend's teeth. The tables have been turned and the guy is panicking. I'm a panic. I will never be peaceful when I'm getting an IV line inserted on me. But I'll require for you to relax when I'm putting it on you. It is what it is. How teachers explain it, how the friend explains it one day before exam. True. I have seen these types of headache, migraine, hypertension. This is a lie. Life of a doctor. Sleep anywhere. And yet when people find you asleep, they're like, why are you sleeping? And yet you are sick. Shortest love letter by a cardiologist. With you, without. With you after marriage. Arrhythmia. Yeah, what is this? This is an artifact. So the with you part is the normal heartbeat. The without you is an asystole, so the heart isn't beating, so without you I'm dead. The with you after marriage is a confused rhythm, more of an arrhythmia, not an, as in no heart beats this way unless the leads have been placed incorrectly, the ECG machine, sorry. So due to personal reasons. And that is that. Thank you for coming on board. Hit that subscribe button. I might break it into several parts, or I might not. I may just put one video and you guys enjoy. So subscribe button somewhere here or here. Thumbs up if you liked it. Comment, engage with me.